Hi, my name is Jessica Bettendorf, and I am doing my presentation on Adlerian theory. Give me 1 second, see if I can make it bigger. Great, there we go. All right, so here are some key concepts for Adlerian theory. So Adlerian theory provides a theory for understanding a person within their environment. Birth order. The impact of birth order in a family is a subjective interpretation of a person's family position. A counselor needs to understand their client's thoughts and feelings about their birth position in the family. Only children are more inclined to be high achievers and conscientious. They're interested in perpetuating family values and are more likely to be pampered by their parents. When parents are capable, an only child may feel unable to compete at the parents' level and could become discouraged. When parents are doting, the child may be unable to provide for themselves as an adult. So next up is the oldest children. They are often loved and nurtured until the birth of the second child. They may be more likely to be a problem child. Also, they may feel sensitive toward and responsible for younger children. The oldest child could suffer from neuroticism or substance abuse problems. They could also seek adult approval and tend to be perfectionistic, hardworking, and conscientious. So, interesting side note, I'm an oldest child, and a lot of these traits actually describe me perfectly. I'm not going to go into which ones though. A second born child may be highly competitive. The middle child, life often appears unfair to them. They are sensitive to criticism and are easily angered. They may rebel against family expectations. They may constantly compare themselves to others. They can develop a poor me attitude. And in families with conflict, the middle child may be a peacemaker. Next up, we have the youngest child. This is the most overindulged, the baby. They may feel inferior because everyone else in the family is older. They typically depend on the family for things. That describes my little sister perfectly. Next up is family constellation. This is a way to describe each member's niche within the family system. It consists of parents, children, and extended family members. And then we have early recollections, which is a pretty important Adlerian concept. Early recollections are important ways to understand a person's development. They provide clues that are helpful when trying to find direction for a person striving for social interest. They can also reveal what is valued and what is dangerous. Early recollections are the memories that one retrieves and how a person's perception is reflected in the choice of their recollections. All right. So next are some major constructs. So first we have socially embedded. I have to move this, I can't see. It reinforces the responsibilities of society. Then private logic. This is how a person evaluates the self of others and cooperates with others. Minus situations. These are inferiority feelings, negative reactions to a person being aware that they cannot function how they wish. Plus situations are superiority, mastery, completion, working toward goals, and having a purpose in life. So you might find yourself in a plus situation if you are working in a job that you find very fulfilling, that you love. So Adler also suggested 4 basic types of people. One is dominant or ruling. So these people seek domination over others. Pretty self-explanatory. 2 is getting or dependent. These people assume others will take care of them. 3 is avoidant. Again, self-explanatory. These people will seek to avoid problems at all costs. They might not like drama. Maybe they want to please other people so they don't stir up any trouble. Then we have socially useful people. They cooperate and contribute to the active world. So one of the central processes of Adlerian counseling is encouragement. And that is where the counselor encourages the client by awakening their social interests. So next are some terms and definitions. First up is organ inferiority. This is the idea of compensating for inferiorities by developing certain skills or personality traits that can aid the individual. Holism. With holism, a person is not internally divided or developed with conflicting forces. Adler viewed the person as a whole organism in which all parts function cooperatively, even when different within a family, their culture, their community, and the world. Goal orientation includes lifestyle goals and immediate goals. Conjunctive and disjunctive emotions. So with conjunctive emotions, these allow a person to stay connected through love, empathy, and joy. A person with disjunctive emotions creates problems of anger, hate, or fear. Unity of lifestyle allows a person to choose emotions and achieve their goals. Emotions are not something to control the individual. Rather, the individual learns to use emotions to pursue goals. I like that quote. The philosophy as if. This is a concept that a person reacts as if understanding the world and as if everything seen and experienced in the world influences their reactions and behaviors in the present. So the way I look at philosophy as if is kind of like fake it till you make it mentality. But I will talk more about that further in my presentation. So next is fictional goal. This is the ultimate truth that is beyond a person's interpretation. Partial or biased truths need to be created as fictions used in life. Gemeinschaftsgefühl. I hope I pronounced that right. I am part German, but I'm not fluent. So this is a pretty common, this is a big theme in Adlerian theory. It is a German term referring to social interest of community, a central idea of Adler's theory. It is the innate drive of a person to cooperate and contribute for the common good. And finally, life tasks. So there are 3 main tasks that one must accomplish in life, according to Adlerian theory. And that is work, community, and love. And as your social interest builds when completing these life tasks, your inferiority feelings will decrease. All right. So I think oh, no. All right. Next up, we have the role of the group leader with Adlerian theory. So first part is meeting members. The group leader starts off the group by asking members to briefly introduce themselves. Then they ask members what agreements they want in group. Adlerians do not use the concept of group rules, which can suggest the therapist's authoritarian history. Agreements, on the other hand, give members a sense of control. Next is the psychological investigation. So after introductions are made, leaders move on to the psychological investigation, which focuses on personal patterns and motivations expressed within the group. Members can choose to discuss whatever they would like. Sometimes it is enough for the leader to simply say, "What should we talk about today?" Next is a subjective interview. This group intervention seeks to develop individual storylines and a group consensus regarding what is relevant and important for the group members. The first step is to find a common language of inquiry. The group leader must also balance the individual storylines with the need for group interaction and find commonalities within the multiple storylines to build a sense of cohesiveness. Next is the question. Oops. So the question is another Adlerian intervention, which I will actually discuss later in my presentation. Next, we have the objective interview. So many Adlerian group leaders will skip the objective interview when they develop an understanding of the people in the group. But this technique involves gleaning an understanding of each group member's family constellations, their approaches to life tasks, and or interpretation of their early recollections, which I talked about earlier. Next is psychological disclosure. So this could happen at any point during the group process. The members are invited to investigate meaning in each other's lives. Psychological disclosures are used to create understanding by making unconscious processes conscious and or confronting useless interactions in the group. Next is psychological reorientation education. So this is the endpoint in group therapy and involves changing members' stances in life by helping them cope and approach life tasks in a useful manner, which requires moving away from self-absorption, withdrawal, and isolation. So lastly, I'm just going to talk a little bit about group problem solving. Successful group problem solving depends on establishing psychological understanding of the self and other people involved. Problem solving includes establishing an atmosphere of safety and mutual respect, asking group members whether they are open to input from others, generating multiple possible options, and identifying a constructive possibility that fits the client. All right. So here are some more Adlerian group leadership skills. So first is structuring. This establishes the guidelines for the discussion, clarifies misunderstandings, and states the purpose of the group. Next is universalizing. This helps others realize that their concerns are shared. One such way is by saying, "Who else has felt that way?" Linking. That is when the leader points out group members who have something in common. Redirecting, when the leader wants the members to talk directly with each other. Goal disclosure, when the group is working on behavioral problems and to guess the person's goal in performing the behavior. Brainstorming, self-explanatory, accepting all ideas when a solution is sought. Blocking, intervening in destructive communication through structuring and modeling on the part of the leader. Summarizing, This can occur anytime, but is helpful when one wants to understand what happened in the group. Task setting and obtaining commitments. This means making discussions and ideas into concrete behavioral actions. Promoting feedback. This is a process of exploring how one is perceived by others in the group. Promoting direct interaction allows members to speak with each other. And lastly, promoting encouragement, finding what is right or okay in group members and letting them know. All right. So here are some basic responsibilities of group leaders. They follow the process of all group members, regardless of their beliefs, feelings, and intentions, and create an atmosphere where members can achieve their goals and learn how to help each other. Leaders pay attention to the content of members' messages and the method, setting, and timing of the messages. All right, so next up is multiculturalism and diversity. Adlerian theory addressed social equality issues long before multiculturalism became a focal issue in the helping profession. Adler campaigned for the social equality of women and spoke out against the marginalization of minority groups. Adlerian theory is congruent with the cultural values of many minority, racial, and ethnic groups and is respectful of cultural diversity. For instance, Adlerian therapy goals are not aimed at telling clients what they should change about themselves. Rather, the clinician works in collaboration with the client and their family. It has a pragmatic approach that is flexible and offers action-oriented techniques to explore problems with the client's social cultural context. All right, more stuff on multiculturalism. Adlerian theory is flexible enough to deal with the individual and their family, making it suitable for different racial and ethnic groups. The theory also pays attention to the role of religion and spirituality in the lives of clients. Counselors should work with clients within their social and cultural world and be skilled in recognizing how culture can impact their views and their clients' attitudes and beliefs about their world, including social aspects within a community based on oppression, racism, elitism, and sexism. And counselors need to develop intervention strategies and techniques that are appropriate for each client's needs based on their culture. All right. All right, so if you're paying attention earlier, social interest is a big piece of Adlerian theory. So Adler saw a person's culture as derived from the person's subjective view of life. From Adler's cultural perspective, social interests include helping, participating, cooperating, empathizing, and contributing. A balance happens when a person can achieve their goals and improve the welfare of others. So Adler's social interest has three aspects. One, innate aptitude. This influences the striving toward social interest. Two, abilities. This is developing skills such as cooperating and contributing. And three is generalized attitude. So parents, teachers, mentors all model how to be useful so that children can generalize their experiences to develop social interest and a sense of community. The core of Adler's theory is a person capable of cooperation within society and always striving for self-improvements. The concept of social interest is personally fulfilling and beneficial to others. So here are some strengths and weaknesses of Adlerian theory. Strengths. It's suitable for at-risk children struggling with delinquency, useful for addressing women's rights and gender equality, adult education, teacher training, community mental health. It can be used in family counseling, couples counseling, group counseling, career counseling, and child guidance clinics, along with brief counseling and psychotherapy. It is a strength-based growth model opposed to a medical model. Therefore, it is widely applicable to many areas in the helping professions. And then the weaknesses. So Adlerian theory has been criticized for its lack of depth. Its assumptions place undue weight on concepts such as birth order and early recollections. They're not always going to be specific to human development. It has a large number of concepts, and there is some difficulty defining said concepts. There's lack of empirical evidence and comparative analysis, and few of Adler's concepts have been measured in terms of cause and effect. All right. Sorry, more water. All right, so here are just some of Adler's interventions. There's more, which I'm going to talk about later. So first up is the push button technique. So this technique seeks to interrupt a depressive episode and helps clients become aware of their role in maintaining or creating their unpleasant feelings. So this technique has 3 phases. In phase 1, clients are instructed to close their eyes and think of a pleasant memory from a time when they felt happy, loved, successful, and more. The client is asked to imagine the memory in great detail and focus on the positive feelings associated with that memory. In phase 2, clients close their eyes again and imagine an unpleasant memory, time when they felt sad, unloved, rejected, etc. And then strongly focus on the unpleasant feelings associated with that memory. In phase 3, clients are asked to think of another very pleasant memory and focus strongly on the positive feelings. Then clients are asked to open their eyes and share what they learned from this experience. Clients typically make the connection between feelings and beliefs, but if they fail to do so, counselors can help them understand how certain thoughts can generate certain feelings. When the clients push the negative push button, they create unpleasant images that can make them feel bad. When they push the positive push button, they create pleasant images that positively affect how they feel. So this technique gives the client some control over their feelings. All right. Next up is spitting in the soup. So this is a way of interpreting goals to facilitate change. It assists the client to recognize possible behaviors they may have been unaware of that are not aligned with their goals. Counselors can work with a client to create a cost-benefit analysis, which is basically where the counselor and the client discuss the meanings of behaviors and consequences, like the pros and cons. Next is catching oneself. This encourages clients to catch themselves when performing their problem. It involves helping clients identify the triggers associated with their problematic behavior or emotions. And then we have a lifestyle analysis. So this is information about the client's family, life goals, and beliefs, and it is all assessed and includes an exploration of the client's subjective perceptions of their family, including their childhood. It's very in-depth. All right. So now I am going to talk about applying Adlerian theory to the case of Joe. So here are just the main bullet points, but I'm going to read the whole thing now. All right. So from the lens of Adlerian theory, I would infer that Joe was a middle child, evidenced by his behaviors in group. According to Adlerian theory, life appears unfair to middle children. They are sensitive to criticism, easily angered, and may rebel against family and societal expectations. Middle children may also consistently compare themselves to others and develop a poor me attitude. Joe did not appear to care what other members in the group had to say. He was only out for himself and had a victim attitude, believing that no one cared and no one could help him. Adler believed that there are 4 basic types of people. And from reading Joe's story, it sounds like he is a dominant or ruling type, in which they seek domination over others. Joe's long sighs and disrespectful outbursts could be his way of attempting to control others and assert his dominance. A dominant or ruling individual is unprepared to meet life's demands and may experience addictions, neuroses, psychosis, or other issues. Adlerian counseling varies, but is all based on Adler's assumption that each client is unique and is designed to assist the client with growth. So Adler suggested 3 phases of counseling. 1, understand the client. 2, explain the client's behavior to them in a way that makes sense. And 3, strengthen social interests. So with this in mind, as a group leader, I would first need to try to understand Joe by attempting to see things from his worldview and empathizing with his struggles. Then I would need to explain to Joe how his behavior in group is affecting the other group members by using confrontation. So confrontation is used in Adlerian theory as a way of holding the mistaken goals and beliefs in front of the client, like holding up a mirror. This technique provides a great opportunity to make immediate changes in beliefs, behaviors, and moods. The hope is that confrontation will help to develop Joe's sense of belonging and empower him to change his behaviors by increasing his self-awareness. So, before moving on to the 3rd phase of counseling, which is strengthening and implementing social interest in Joe, I would use the technique acting as if, which I talked a little bit about earlier. So with this technique, the counselor asks the client, in this case, Joe, to begin acting as if they were the person they would like to be. Using this technique, counselors can emphasize that the client is only acting, the purpose of which is to bypass potential resistance to change by neutralizing some of the perceived risks. So I believe this technique is suitable for Joe because he appears very resistant to change, maybe due to fear of the unknown. So the counselor will suggest a simple task, such as acting as if the client has the courage to speak up for themselves. The expectation being that the client will complete the task. If the task fails, then the counselor will explore with the client what kept them from succeeding. So one thing I could ask Joe to do would be to act as if he really cares about the other group members by asking them questions, asking them how they cope with anxiety, at least feigning some interest in their lives. So if that fails, another approach to this technique is to ask the client to take a step back prior to acting as if. And this is called reflecting as if. So this process encourages the client to reflect on how they would be different if they were acting as if they were the person they desire to be. If Joe is resistant to engaging in the as if technique, the reflecting as if technique may be more suitable. All right, so once he is ready, I would attempt to work on phase 3 with Joe. This is known as Gemeinschaftsgefühl, which I spoke of earlier as central theme in Adler's theory. This term is used to define the goal of belonging to a social group, and it describes the innate drive of a person to cooperate and contribute with others for the common good. So a person will strive to overcome inferiority feelings through self-improvement, self-completions, and contributing to others and society. So I would educate the group and Joe on Gemeinschaftsgefühl, what it is and why it is important. And perhaps through the idea of striving for social interest, other group members will choose to stay in the group and help Joe. That is the hope. Lastly, a person develops social interest in the absence of self-centeredness and neuroses. All right. All right, so for the addictions group, I think a suitable Adlerian technique is called the question, which I mentioned earlier. So with this technique, counselors ask variations of the question, how would life be different if all of a sudden you didn't have this problem anymore? Other variations are, suppose I gave you a pill, ... Or what if you had a magic wand? What if you woke up in the morning and no longer had cravings to use or urges to use drugs or alcohol, ... So this technique pushes clients to think of a new reality where they are no longer burdened by their presenting problem. Clients will either be unable to hide what their addiction is doing for them, or they will feel encouraged because they'll understand that they have the resources and abilities to overcome their addiction. All right, and here are my references. Thank you for watching. Yeah, and have a good rest of your day.